Hi, I'm Caitlin Holman, and I'm going to help explain the etiology of botulism.
Botulism poisoning is due to a toxin produced by a type of bacteria called Clostridium botulinum. Clostridium botulinum is a gram-positive bacillus or rod-shaped, anaerobic, spore-forming, and motile bacterium with the ability to produce a neurotoxin. So as I mentioned before, these bacterium can only thrive in conditions where there is no oxygen, or also known as the anaerobic state. Certain food sources, such as like home canned foods, this provides a great place to have this bacterium grow. And botulism poisoning is extremely rare, but so dangerous that in each case is considered a public health emergency. So the toxin that is produced is known as a neurotoxin, and it is one of the most poisonous biological substances known. The neurotransmission is interfered by blocking the release of acetylcholine, and this is the principal neurotransmitter at the neuromuscular junction. And the intermuscular admission of botulism toxin acts at the neuromuscular junction to cause muscular paralysis by inhibiting the release of acetylcholine from presynaptic motor neurons.
Hi everyone, my name is Orluzia Mitchell. I'm going to present botulism reservoir, signs and symptoms of botulism. Clostridium botulinum is a soil-dwelling bacteria. It is common reservoirs of soil and agricultural products. Spores can also be found in cistern water, dust, marine sediments, intestinal tracts of animals, and food such as honey, canned, and preserved food. Clostridium. Onset of signs and symptoms after contamination. Botulism symptoms will appear in 18 to 36 hours from initial exposure. Depending on the amount of toxin ingested, symptoms can occur as early as 6 hours or as late as 10 days. In botulism infected wounds, symptoms can take up to 2 weeks to appear. Botulism is not contagious. Classic symptoms of botulism appear when cranial nerves are affected. Individuals demonstrate facial weakness on both sides, drooping eyelids, dilated or non-reactive pupils, slurred speech, urinary retention, and respiratory paralysis. Infected infants' first clinical sign is constipation. Other signs may include floppy movements due to muscle weakness, trouble controlling the head, weak crying, irritability, drooling, drooping eyelids, difficult feeding, and paralysis.
Hi, I'm Kayla Stedman, and I will be presenting the transmission of botulism. Botulism's bacterium forms spores, which are small, usually single-celled, reproductive bodies that are highly resistant to drought and heat and capable of growing into new organisms. Under conditions with oxygen, these spores can germinate, resulting in the growth of bacteria and the production of the toxin. Botulism is not transmitted from person to person. Botulism develops if a person ingests the toxins, or rarely if the toxin is inhaled or injected, or if the organism grows in the intestines or wounds and toxin is released. Foodborne botulism is spread by consuming food contaminated with the botulism toxin or spores. It can be especially dangerous because many people can be poisoned by consuming contaminated food from the same source. Foods commonly associated with botulism include inadequately home-canned foods with low acid content such as asparagus, green beans, beets, and corn, or lightly preserved foods such as fermented, salted, or smoked fish and meat products. Wound botulism occurs when the spores get into an open wound and are able to reproduce. It can result from contamination of wounds by soil, gravel, or improperly treated open fractures. It has also been associated with the use of injectable street drugs. Infant botulism occurs when infants ingest the spores. In most adults and children older than 1 year, the body's natural defenses that develop over time prevent the germination and growth of these spores. However, because infants have not yet developed these natural defenses, the spores grow in the infant's gut, producing the bacteria that releases the toxin. Honey and corn syrup are the food sources for infant botulism. Adult intestinal colonization botulism is another form of botulism. It is similar to infant botulism, but occurs in older children and adults with bowel abnormalities such as colitis, intestinal bypass procedures, or in association with other conditions that may create local or widespread disruption in the normal intestinal flora. The 2014 statistics on botulism that I found, that laboratory confirmed foodborne botulism accounted for 9% of the cases. Infant botulism accounted for 80% of the cases, wound botulism for 10% of the cases, and botulism of unknown or other etiology for 1% of the cases.
Hi, I'm Keely Imwa, and I'm going to tell you about the treatment and prevention of botulism.
One of the ways to treat foodborne botulism is to clear out the digestive system by inducing vomiting or by using medications to induce bowel movements to get the toxins moving out of the body. If foodborne botulism is caught early enough, the person can be injected with an antitoxin, which helps to reduce the chance of complications. The antitoxin attaches to the toxins in the bloodstream and keeps it from harming nerves. There is a different antitoxin called botulism immune globin used to treat botulism in infants. If wound botulism is contracted, there's a recommended course of antibiotics as a treatment. And if the wound botulism is severe enough, surgery may be required to remove the affected tissue. If needed, a person can be on breathing assistance for a few days to a few weeks since botulism affects breathing and swallowing, and some people may need rehabilitation after contracting botulism for speech, swallowing, and the effects of paralysis. To prevent botulism from ever happening, we need to start in the kitchen and be aware of the food we are opening and consuming. Home canning can be a source of foodborne botulism when a proper seal is not achieved. To make sure home canned goods are safe, always use proper canning techniques and processing times. For all foods, prepare and store food safely and don't eat anything if the container is bulging or if the food smells off or spoiled. It's better to toss a can of peaches or tomatoes than to risk getting botulism. This goes for all foods, not just home canned goods. Another big no-no is storing cooked potatoes at room temperature because it's not in the safety zone and it's a good environment for bacterial growth. Always store infused oils with garlic or other foods in the refrigerator and use them as quickly as possible to prevent the growth of botulism. It's also safer to buy infused oils rather than to make them at home. Never give honey to infants under 12 months of age. Even a teeny taste of it can introduce the botulism spores to an infant's body, and they can grow sporadically. And lastly, never inject or inhale street drugs.